You always knock them dead, Kiki.
Thank you. Okay, we're 10 a.m. Are we here?
Nope, not yet. I'm going to start recording, and then I'll open it up for everybody to join.
Okay, please let me know.
You always knock them dead, Kiki.
Thank you.
People are just joining the webinar now. It'll take about 30 seconds for everyone to join, and then you're free to begin anytime you like, Kike.
Okay, right now? All right.
About 20 seconds, Kike.
20 seconds. Ready? We're live.
All right, you're good to go, Kike.
Hello, everyone, and welcome. We're so pleased that you can join us for our 10th anniversary of Ryerson's Social Justice Week. We are going to give people a few minutes to join us, find us in cyberspace. And while people are joining us, we want to let you know a little bit more about our program, how to find more information about our program and how to stay in touch with us. You'll see on the screen in front of you, there is now a slide that shows you how to get in touch with us. You can get in touch with us by email at sjchair@ryerson.ca. Our website is ryerson.ca/social justice. You can reach us on Twitter at RySJChair, on Instagram at Rye Social Justice Chair, on our Facebook page at Unifor National Chair in Social Justice and Democracy. And so those are all the ways we want to hear from you. Please get in touch with us and let us hear your feedback. What are you learning? What are you taking away from the session? What more did you want to know about? We will definitely be looking at all of that. So, okay, again, as you're joining us, as more are joining us, thank you. This is the opening event for our 10th anniversary of Ryerson Social Justice Week, and we're starting off with housing in crisis. This year, our theme is Beyond Walls, Beyond Borders, and we want to start off by situating ourselves. And we know that Ryerson and many of us are here in Takaronto, Toronto, on the lands of the Haudenosaunee, the Anishinaabe, the Mississauga of the Credit First Nation. And these are, of course, territories that are governed by the Dish with One Spoon Wampum. That was a treaty that bound the Haudenosaunee, Anishinaabe, and Mississauga of the Credit First Nation to share the territory and to protect the lands. And because they did their work for so many centuries, we are grateful and privileged to be on this territory. Our thoughts are with all of those who have been caring for the lands and the waters for so many generations. Our thoughts are with those who have been evicted from their homes, from those who've been expelled and dispossessed from their homes in Turtle Island and across the world. I think also of all of the peoples of African descent and peoples forced from their homes and their ancestral territories into these lands. We are grateful to be here, and our thoughts are also with the Mi'kmaq peoples, the Wet'suwet'en peoples, and others who are standing up to protect their homes. In addition to that land acknowledgement, we also want to say that as Professor Jill Carter of U of T notes, that Zoom itself has been erected and it has its headquarters in the San Jose, California. And this is actually the traditional territory of the Muwekma Ohlone tribal nation. So although we're gathering in cyberspace, Zoom is actually rooted with its headquarters on Indigenous lands as well. And we are able to connect with each other via Zoom, and we're deeply indebted to the Muwekma Ohlone people, as the lands and waters that they have protected and continue to steward now support the people and the technologies that carry our breaths, our images, and words across vast distances to others. That's a direct quote from Professor Jill Carter. So thank you to those people, and thank you to our creator of Ryerson Social Justice Week, Winnie Ng. We want to thank her for having the great idea to pull us all together across disciplines, across campus, to come together to bring our minds together on what social justice looks like. What does it mean? So thank you, Dr. Winnie Ng. Thank you very much to the Social Justice Week Planning Committee, to the Faculty of Arts, the Dean, Pam Sugaman. We want to thank the Faculty of Community Services, Dean Lisa Barnoff, the Faculty of Law, Dean Donna Young, who is sponsoring this session today. We also want to thank our ASL team from Toronto Sign Language interpreters. You see Marcia right now, and Christopher will also be joining us. We want to thank our captioning team, CCS, and Lori is helping us with the captioning today. We want to also thank our media services team and the assistance we're getting from Luke right now. We want to thank all of our sponsors and our communications team. And I want to say a very special thank you to Salman Khan, who is the assistant to my chair, the Unifor Chair in Social Justice and Democracy. And Salman has done a phenomenal job keeping us all together and on track, organizing everything. And he's an awesome person to work with, who has been with Social Justice Week since its inception in 2011. Thank you, Salman. So over the years, Social Justice Week has turned to one of our ongoing sponsors, Ryerson's Aboriginal Education Council. We've turned to the Aboriginal Education Council for support, for guidance, for collaboration, and this has really been very much appreciated. So we're honored to have AEC Chair, Elder Joanne Dallaire, who is going to open up Social Justice Week for us in a good way. Elder Joanne Dallaire is a Shadowhawk woman of the Wolf Clan. She is Cree Omushkego with ancestry from Attawapiskat, Ontario. And she has done so much work playing so many different roles over her long career. She's helped leaders at the Toronto District School Board, as well as at Ryerson, to incorporate Indigenous knowledge and experience in organizations. She's done that for many organizations, and she's been at Ryerson for, I think, over 14 years now. She's done counseling, advising, educating on a whole vast range of Indigenous issues and concerns, help people with empowerment and capacity building in many different organizations. She sat on numerous committees and has really put a focus on helping Indigenous and non-Indigenous people work on our relationships. She's done that through her business as well, Healing Works. We're particularly honored to have Elder Dallaire open today because in addition to all of this work, she has served many, many communities treating people with addictions. She has counseled the homeless and done a lot of work with people who have experienced homelessness. She's also worked in the jail systems and she's provided not only that kind of community building support, capacity and institutional building support, but she's also provided drumming and spiritual circles at grassroots agencies and led those for those of us who've been honored to be able to participate with her at Ryerson. So with that, I'd like to turn it over to Elder Joanne Dallaire.
Good morning, everyone, and thank you very much, Kiki, for that wonderful opening. It has always been my honor to work with people who are marginalized, to say the least. So I'm going to jump right in here. I'm going to offer the Cherokee morning song. I'm going to do it a cappella. And the reason that I want to do the Cherokee morning song is the teachings behind this song is that the sun rises every day in the east to remind us of a new day. Yesterday is behind us and we are encouraged to learn from that. And tomorrow is yet to be seen. So our true power lies in the moment and the things that we do from today. And then I'll be moving into my prayer to welcome Social Justice Week and to kind of put us in a symbiotic mindset and our relationship with all that be. So here we go. Windeya-ho, windeya-ho, a windeya, a windeya, ho, 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 hey-a-ho, hey-a-ho, ya, ya, ya. Windeya-ho, windeya-ho, a windeya, a windeya, ho, 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 hey-a-ho, hey-a-ho, ya, ya, ya. Windeya-ho, windeya-ho, a windeya, a windeya, ho, 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 hey-a-ho, hey-a-ho, ya, ya, ya. Windeya-ho, windeya-ho, a windeya, a windeya, ho, 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 hey-a-ho, hey-a-ho, ya, ya, ya. Wache, Ani, Sego, Nit, Kwe, Tense, hello. Adishna Hasan, Sahakutam, Tashashan Ishku, Mahikando Deamo Mashkiko. First, let us give thanks to all the people who organized this event, who are working so hard behind the scenes today to make it possible. And for all of you who have chosen to attend, I wish you all well. We give thanks for this day, this opportunity to continue to open our hearts and open our minds to a new way of seeing and a new way of being. I ask that each and every one of us is watched over, your families and your loved ones. I also like to take this opportunity to ask you to continue to watch over our brothers and sisters who are on our streets, in our jails, our institutions, hospitals, seniors' homes, shelters, and treatment centers. And we give thanks for any plant and animal life that will give of themselves today so that we can move forward. And for all those people who work so very hard behind the scenes to get our food ready for us, we thank them. We give thanks to Mother Earth and for all that she provides for us. And we beg for her forgiveness and pray for the healing of her waters. We give thanks to Father Sky, who watches over us and tends to the star people and reminds us of the many things we have to deal with from day to day. We give thanks to Grandfather Sun, who shines his energy of life upon us and reminds us that too much of something may not be good for us. We give thanks to Grandmother Moon, who when she is full, she lights our way in the darkness. And when she is a new moon, she reminds us that even in the darkness, the light is there. And she also gently reminds us of the many phases we will go through from month to month. We are a symbiotic relationship with all living things. Everything that each of us do has an impact and effect on everyone. I ask that all the messages that are here this week get out and that people continue to fight for the injustices in our society. And I say, Chimigwich, 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 aho, all my relations, hi, hi. I just want to add a couple of words before I finish off here. At no other time in our history, at least in my history on this planet, have we seen such an upheaval of what we know to be our day-to-day lives. And of course, the marginalized are the ones that are impacted the most. So I ask that everyone come together, put your thinking hats on, and see how we can make the lives of those people who need our attention, need our love, and need to be reminded that we haven't forgotten them. I thank each and every person sitting here today for the honor to come and do this. I really respect all the work that is done here. Thank you very much, and I'm wishing a wonderful day for everyone. Chimigwech.
Chimigwech to you, Elder Joanne Dallaire. Thank you so much for your words and your wishes and for opening us up in the right way. I would like to now introduce our moderator, Emily Hill. Emily Hill is a senior staff lawyer with Aboriginal Legal Services, and that's an organization that provides free legal assistance to low-income Indigenous people who are living in Takaronto, Toronto. ASL is also involved in law reform, in community organizing, in public legal education, and in test case litigation. And Emily has been with ASL for about as long as Social Justice Week has existed, about 10 years. And she's worked in many different areas, in criminal law and family law, child protection, in mental health law. She's represented clients at tribunals, inquests, at all levels of court, including as an intervener at the Supreme Court of Canada. And she also represents ALS in a number of working groups and research projects. And we're particularly thrilled to have her as our moderator, as she's been recently dynamically involved in taking this city to court to try to make sure that we can get some kind of accountability from our municipal government that has just fallen down, as we've seen when it comes to the housing crisis. So Emily, take it away, please. Thank you.
Thank you so much, Kike. Thank you for the invitation to be part of this panel. I know I'm going to learn a lot. And thank you, Joanne, for that beautiful song and prayer to bring us in mind of the work that we can do together today and the learning that we can do. I think our plan is to just have every speaker speak for about 10 minutes and then have a broader conversation. And my job is to introduce folks and then also to try to keep us within our time. So without taking any more of time right now, I'll move to our first speaker, Steve Teakins. The full bios are available in the event page, so I won't take time going through the full biographies, but just to say that Steve Teakins is a member of the Nipissing First Nation. He has a master's degree in public administration from Queen's University. He is the executive director at NamiRes, the Native Men's Residence here in Toronto, and he has worked there since 2008. In addition to that, I am sure more than a full-time job. He also teaches traditional drumming to youth and men at various Native organizations inside and outside of Toronto. I know he does that work at ALS, and we are always grateful to have him there. So I think we'll start with Steve and then move on to our next speakers. Thank you.
All right. Good morning, everyone. I'm just wondering if I'd be able to share the screen.
Just give me a sec, Steve. I'll make you a co-host and you'll have that ability.
Great, great. So yeah, I have a few slides prepared for this presentation today. So I just want to say, I'll introduce myself. Bonjour, Josh Koje, Jiwang Nabe, Mandadonane, Desnakaz, Wabishe Shidodem, Nibisinadunj, Wabishe Shidodem. So I just introduced myself and my spirit name. I'm the Martin clan from Nipissing First Nation. And here we go. Here's my screen. Oh, wait a minute. From the slide. Isn't technology great? No, not that one. Okay. Let's maybe forget the share screen. Anyways, for Indigenous homelessness, there's lots of challenges.
Slideshow. If you check on slideshow,
yeah, where is that?
That'll bring it just right beside. Yes.
There we go.
That should
from the beginning. Wonderful. There we go. Yay. All right. So anyways, my name's Steve Teakins. I'm the executive director of NamiRes, Native Men's Residence. We offer a whole bunch of services. So what's the cure to homelessness? And that's for anybody. Well, it's housing. It's really simple. It's not rocket science whatsoever. You know, if you get housed, you're no longer homeless. Well, for Indigenous people in Canada, it's been an eight-decade-long plight, I guess, to get adequate housing, not only on reserves, but also in urban areas. 80 years. Imagine that. You know, if other Canadians had to go through this, I imagine it would be a very different scenario. So, you know, this isn't a new phenomenon. And in fact, there's 17 royal commissions that the government had from 1934 all the way up to 2015 that talks about the need for Indigenous housing. You know, and the government can't claim complacency with this. It's been a real thing. Indigenous people are overrepresented within homelessness. And, you know, for Indigenous people becoming homeless, well, we're basically at the bottom of every meaningful statistic in relation to, you know, the social determinants of health. And, you know, in addition to that, you know, we have the legacy of dealing with the trauma related to residential schools, adoption scoop, loss of culture, and loss of our family units. And myself personally, I'm the grandchild of residential school survivors. I'm also the child of 60 scoop survivor. Fortunately, I've been able to, you know, not deal with too much baggage around intergenerational trauma. And, you know, I thank my parents for that. But in addition to this, you know, in Toronto in 2018, when the last street needs assessment took place, 16% of the overall people counted in that assessment were Indigenous. And now there's been 4 consecutive street needs assessments. The overall count for every single one of them has been around 16%. One year it was only 15%. But of those outdoors, the overall population is 38%. So of those sleeping outdoors, Indigenous people are well overrepresented in that regard. But yet we only represent maybe 1 to 2.5% of Toronto's entire population. Then another interesting statistic from the last street needs assessment, it identifies that of the Indigenous population that were counted in that street needs assessment, 64% were Indigenous males. So that's a very disproportionate number. Our men, you know, bear the brunt of those that are homeless. So in the 1970s, there was a mass migration, even a little bit before then, but more so in the 70s, of people leaving their First Nations communities and coming to urban areas, might be Métis communities as well, or Inuit. And you know, they were leaving for quite a number of reasons: severe overcrowding in the substandard housing in many of our First Nations communities and Inuit and so on. And then unsafe drinking water, you know, that's still a legacy today that many First Nations deal with, as well as lack of reliable electricity, all kinds of economic and educational shortcomings, and very little employment. So there was a lot of people coming to the city to seek a better future. So this is the National Indigenous Housing Strategy. Yeah, if I had more to share about it, I would add it here, but this is what it looks like to me right now. It's been a lot of talk, very little substance, and it's still talk. And it's a real shame because the Canadian National Housing Strategy, it was released without delay, maybe a few, but you know, the Indigenous piece is still forthcoming. And you know, hope it comes soon, because you know, it's better late than never, right? So how do we reconcile national Indigenous homelessness? Well, some of my suggestions are come up with a national Indigenous housing strategy that's, you know, adequately resourced for both on reserve, off reserve, with a strong component for urban. Culturally appropriate and diverse Indigenous-led programs for Indigenous people. You know, for Indigenous, by Indigenous. We know our community the best, and we're probably in the best position to help our community move forward. We need more Indigenous governed and led shelters, not necessarily religious affiliated ones. You know, the residential school and the legacy related to that, religion has done more than enough harm to our communities. And you know, we don't need any more of those. We need to get more involved with our culture and finding our traditional ways of healing. More Indigenous harm reduction programs. We have a lot of Indigenous people that are homeless out there that are hurting, that use drugs and alcohol to help them mask some of the pain they feel. And you know, we need to reach them at the level that they're at. And if abstinence-based is the only approach, it's not necessarily going to be as effective as if we were using harm reduction and non-judgment. More Indigenous specific outreach programs. You know, at NAMI Res, we have a outreach program that was the first Streets to Homes program in Toronto. You know, we trained the City of Toronto staff, and by essence, I believe NAMI Res was the first organization in all of Canada to start a housing first program. So we're Indigenous pioneers, if you will. This is NAMI Res's organization chart. I know in a lot of mainstream communities and organizations, you'll see usually a pyramid model. Well, this model is puts the clients in the center. It's circular. It's an Indigenous governance structure. And all the programs are wrapped around the clients. Those little spheres, if you will, they almost resemble a flower. And those flower petals are the different programs that NAMI Res offers to people. So we have our outreach services that people go around in vans and offer supports and opportunities for housing to people on the streets. We have Sagate, which is a transitional shelter program where we even have beds for men coming out of federal corrections that need a halfway house bed. We have housing, and we have Oguchita Mishkiki Wigwam, which is our affordable housing project. We also have another one called Ginu Pune Wakenogan, which means the eagle's nest, and it's more affordable housing. I think we have 42 units of affordable housing across the city. In addition, we have a mental health program called Minokanagoan, and it's more or less a case management team that roams around and works with Indigenous clients that have severe mental health issues and helps them to get stabilized. We also have a shelter, an emergency shelter called NAMI Res, and it's been around since 1985, and it works with Indigenous men to help them become less homeless. So, and then around this petal of flowers is our admin team that supports our staff to do the important work that they do. And in addition, these outer rings are my role as executive director. I'm looking outside as well as looking inside for opportunities to help better serve our clients.
What about 2 minutes, Steve, just to let you know.
Yeah,
thanks.
We have our circle of directors, which is, other places refer to them as board of directors. Our circle of directors, oversees the governance of the organization and helps set our strategic direction. So NAMI Res over the years has created a lot of interesting ways to deal with the overrepresentation of Indigenous homelessness. We have life skills programs called Pinamoanine, which means having the confidence in myself. And in that program, some of the things we do is language instruction, introduction to feasts and ceremonies, and we teach Ojibwe language and Cree language to our residents. COVID hasn't been easy at NAMI Res. We've had to deal with a lot of challenging times. We had COVID in one of our shelters early on. And when I reached out to seek help to help us deal with that, I got a lot of answering machines and people that were working from home answering machines. So we had to deal with this ourselves. We had 2 cases and we dealt with it very effectively. We stopped an outbreak. As a result of that, I noticed that the Indigenous community felt like we were by ourselves a lot of times among our organizations and dealing with stuff related to COVID and providing services. So, as an act of self-determination, we opened up our own Indigenous COVID testing center called Adoje Minno Nesewinong, which means a place of healthy breathing. We operate 4 days a week. This is a service for the Indigenous community. It doesn't matter if you're homeless or not. And we see this as a way forward. If you pay attention to the media, there's been a lot of racism stories coming out about Indigenous people seeking health care. This is something that would maybe mitigate those factors. We offer our services in a culturally safe manner to Indigenous people. And it's a safe place for Indigenous families and individuals to come get tested. We have Indigenous physicians, Indigenous nurses. It's for Indigenous, by Indigenous, at an Indigenous organization. You couldn't ask for more. So, I'd like to say, Chimigwech, I wish I had more time because I could talk on and on and on about Indigenous homelessness and get more into the weeds about few details in relation to homelessness and some of the contributing factors. But bottom line is we need more housing. So miigwech, everyone. Have a wonderful day. Got a little bit dressed up today, wearing my beaded bow tie. So have a wonderful day. Thank
you so much, Steve, for that, for reminding us of the reality and the root causes of Indigenous people experiencing homelessness, and also that the solutions lie not with more reports or studies, but with solutions that are led by the Indigenous community. And I hope we'll have a chance to hear more from you about that in the Q&A. I'm now going to turn over to, oh, and your bow tie looks awesome. I'm going to hand over the virtual microphone to Kathy Crow. Kathy Crow is a street nurse. She's also a filmmaker and an author who works nationally and locally on health and justice social issues. She is the recipient of numerous awards, including honorary doctorates in law, science, and nursing, an International Human Rights and Nursing Award, and the prestigious Atkinson Economic Justice Award. More recently, she's the author of A Knapsack Full of Dreams, Memoirs of a Street Nurse.
Hi, everybody. Thank you. So I want to begin by saying October is my favorite month of the year. And part of the reason for that is Social Justice Week. It always makes me feel very much at home at Ryerson. So thanks to the organizers and particularly Kike and Salman. Steve, that was a great presentation. It was fabulous, and I hope to hear more from you. So I want to begin with, I just have to set back to how this all kind of hit me in my work role. In 1993, I was a street nurse at the corner of Sherbourne and Dundas when the federal government canceled our national housing program. And when we had that program, we built 20,000 new units of social housing every year across the country. So we're in a big deficit. I would call it a democracy deficit. That's 17 years times 20,000 units. So we're in a deficit of 340,000 units of good housing. 5 years later, it was already showing itself on the streets of Toronto. And in 1998, we declared homelessness a national disaster. And that was done across the country by advocacy groups. In 2017, the federal government kind of used National Housing Day to announce their national housing strategy. And note that they call it a strategy, not a program. And I especially liked Steve's blank slide that made that point better than I could. So since then, the housing crisis and homelessness has worsened every single year across the country, and it's been very evident in Toronto. So to fast forward to today, when COVID hit, the populations that were already facing housing insecurity and homelessness, people who were dehoused or unhoused, and note that's kind of new terminology that really is becoming more popular, especially since the Black Lives Movement, to kind of reduce the discrimination that the term homelessness brings to conversations. So these populations faced tremendous systemic discrimination around equity issues when COVID hit. It was as if there was no pandemic plan, and it seems as if there weren't. So I'm going to show you through some slides. I'm ready for the first slide, just to kind of paint a picture visually. When COVID hit, a colleague used the term, it was like a social X-ray that highlighted inequities. We immediately saw doors close, libraries closed, drop-in centers closed, community centers closed. And these were places where people would access food, caring and support, showers, washrooms, hand washing, computers, phones, clothing, and much, much more. So this is an image, of a library in Toronto closed, a food lineup outside of Council Fire that kept and still to this day is providing meals for people. And the picture on the far right shows the conditions pre-COVID of extreme crowding in an emergency shelter. So the next slide really exemplifies what I call a battle for equity. Everyone understands now that the measures to protect yourself from COVID are physical distancing, wearing a mask, hand washing. I think the writing was on the wall when I realized that it was going to take, it took us over 6 weeks to get portable toilets set up outside of an encampment in Toronto. 6 weeks for the city to bring in only two portable toilets. The banner on this car reflects a car rally that happened where we were trying to fight for more broad screening and testing of homeless people, not just finding and arresting them in encampments. There was no mass surveillance screening arranged for the city's shelter system, which is widely considered to be a congregate hotspot, if you will. It took a long time, and it was only really in June that surveillance screening took place in shelters. And as Steve pointed out, I think many shelters and homeless serving agencies were left really without supports to do even basic screening. Homeless people in shelters were left out of the city bylaw on mask wearing, and it was only on September 4th that the city's shelter division directed shelters to encourage homeless people to wear masks and that they would provide them. And it's really questionable as to whether they are still providing the masks. Next slide. So the next slide will show you, the realities of physical distancing. So these images are all post-declaration of the emergency. On the left, you see a shelter trying to do a very good thing. They're trying to put a little barrier between beds, but that's not going to stop the virus. On the upper right, you see a community center gymnasium. This is John Innes, being used as an overflow site to reduce crowding in shelters. This image was sent to me by a homeless man that was staying there, and it shows crowding. It shows, there's no lockers, there's no sense of home in this emergency facility. The bottom picture is I'm sure you would agree, a very clean, organized emergency shelter, and it is. This is the Willowdale Welcome Center that unfortunately had the largest outbreak in North America in a shelter. They had 180 cases and over 20 staff that were infected. And there's big reasons for that. Many of the individuals staying there were working in the food sector, taxi business, et cetera, and were very much exposed. And there was very minimal support initially for this shelter around testing. The next slide. We went to court. Why did we go to court? We went to court to try to enforce physical distancing in shelters, simply and purely because the medical officer of health declined to issue that kind of an order to shelters. And that was after 300 doctors and nurses wrote a letter to her appealing to her to do a number of things, including surveillance testing and ordering physical distancing and the discontinuation of bunk beds. This is a shelter that you can see, was still using bunk beds. It's also a shelter that had an outbreak.
About 2 minutes, Kathy.
Okay, that's good. And fortunately, and Emily was very much involved in this court case. It was a court case of a legal coalition that very quickly went to court to request this order to protect people. And it's a long story, but essentially we won, but we're still monitoring the city's compliance. So the next slide, this is my second last slide. So this is really just to touch on the fact that encampments across the city have grown dramatically. There's a range of estimates of maybe there's 30, maybe there's 50 encampments across the city. We're going to know more shortly in terms of what the total number is. A wonderful thing happened, which is a group of volunteers formed the Encampment Support Network. And these are a list of things they need. These were very much people in the cultural, artistic workplace settings that were unemployed during COVID. They came together. They're not social workers. They're very creative, and they have formed this network that is supplying what the city should be supplying to encampments. The next slide. So this is my last slide, and it's going to go back to really what Steve pointed out, which is housing is the answer. After World War II, veterans came back from the war and fought for housing because there was a shortage. And what's interesting here is you can see them campaigning outside of the hotel, I think Hotel Vancouver, calling for housing. And the slide on the right, the picture on the right is to point out that after World War II, the federal government put together a reconstruction plan that led to a huge rebuilding effort across the country, which is what I would say we need now, both at the federal and provincial and city level. As Leilani Farha has stated, and Leilani was the UN rapporteur on affordable housing, she states, home has rarely been more of a life and death situation. It will be the only guaranteed protection from here on in. Or as I say, one person or one couple family per room. And that means for now, more hotels and ultimately homes. Thank you.
Thank you so much, Kathy. It's been a real pleasure for myself getting to work with Kathy on this case, and I appreciate your comments today, reminding us of the crisis we were in before the pandemic hit, and the real reality on the ground as the pandemic we began to learn more about how the pandemic happened. Our next speaker, we're going to welcome Shalani Konener. She is a lawyer and executive director at the South Asian Legal Clinic of Ontario. She's been actively involved in several areas of poverty law reform, including lobbying at the municipal, provincial, and federal level for social assistance, housing, immigration, employment, and family violence reform. She's also spearheaded Salco's test case work, challenging issues of racial, gender, and religious discrimination at the Supreme Court of Canada, the Ontario Court of Appeal, and the Federal Court. Welcome.
Thank you, Emily. Thank you all for having me today and for the incredible comments from Steve and Kathy. And you'll probably be hearing variations on the same theme around the issues around housing. But I wanted to talk a little bit today about the work that I do at the South Asian Legal Clinic, and also with a campaign called The Color of Poverty, Color of Change, which is really focused on looking at the intersection of race and different life outcomes for racialized communities in Canada, including housing. And I think Canada hasn't had as robust a conversation about the impact of systemic racism on homelessness and housing in Canada. And that is starting now in a little bit more fulsome way. But unfortunately for people like me, it should have been happening a long time ago. And I want to take you back to 2016 when the government released its national housing strategy. And organizations like Salco and the Color of Poverty noted very clearly that that original strategy did not have race as one of the indicators of homelessness and housing. And we had to push very hard for that consideration to be raised. And I want to talk a little bit about why. Why did we push for that, right? So the reality is poverty and race are really key factors when they intersect that can lead to homelessness. Racialized people in Canada experience disproportionately higher levels of homelessness and poor housing. immigrants and refugees in places like Ontario are at risk of greater homelessness and lack of housing because of higher rates of poverty, because of discrimination, because of cuts to the income security programs that they may or may not be able to access. And because, like Steve said, there's simply a lack of housing, affordable housing and housing services that are targeted at those communities. And I was thinking about that second piece around housing services. And this past weekend, I'm part of a WhatsApp group that works in the Punjabi community in the West End of the Greater Toronto area. And believe it or not, there was a gentleman that somebody just saw sort of slumped over on a park bench and clearly was having an issue with housing and homelessness. And we could not find actually a worker from that community who could speak in that language, who could do street outreach to that person. So what ended up happening is the group of people on the chat got together and figured it out. And it started me thinking about how we have a real significant lack of targeted housing and supports in racialized communities across the country. And that's a piece of the problem as well. I want to direct you, if possible, and if you have time, to Google the Color of Poverty, Color of Change campaign. And when the website comes up, you'll notice that we released an updated series of fact sheets. And those fact sheets actually mined both Statistics Canada and Ontario data to look at the disproportionate life outcomes for racialized communities. And what we found on the whole was that in every type of life outcome, poverty, housing, justice, policing, education, employment, in every type of outcome, people of color, Indigenous people came out significantly worse than their non-racialized counterparts in Canada. By example, South Asians in Canada fall at a poverty rate of 18 to 20%, versus non-racialized people, which are at 10 to 12%. So we're almost double the rate. And so those are really critical things to understand how that larger circle impacts homelessness and housing. But so I want to give you a little bit of a snapshot of what we learned and what we knew when we did that work on looking at the outcomes in housing for racialized communities. So the first thing that we saw was what we dub overrepresentation. So really and truly, the primary destinations for immigrants and refugees who are largely racialized in Canada are larger urban centers like Ontario. And they're also the preferred homes for many communities of color. What we found was that all of those areas are overrepresented in poor quality housing. We also looked at housing costs, and we found studies that tell us that most immigrants were spending more than 50% of their income on housing, and 15% of that group was spending more than 75% of their income on housing. That makes life unlivable. Really and truly, I will echo the statements of everybody else that Canada has a huge lack of affordable housing options, combined with the fact that immigrants are tending and racialized communities are tending to be in larger urban centers. Really, there's a very limited ability to find housing. And many of the people that we work with are not in fact homeowners, but are tenants, renters, right? So some of the things that we noted were that there's a complete lack of understanding in many of the communities that I work with about home ownership, about supportive programs like the first-time home buyers, and really that also there's a corollary discriminatory issue around how the Canada Mortgage Housing Corporation and how banks lend to communities of color. So the ability to even have home ownership is greatly curtailed by that type of discrimination. The other piece, of course, that we hear about repeatedly is, in fact, discrimination in housing at so many levels, at the individual level, right up to the systemic level, right? Racialized people, many immigrants and refugees report facing discrimination when they try to rent places. They report facing discrimination when they try to access home ownership. They're unable to access guarantors. They're unable to access refugees. And we know now that the large majority of these communities are renters, not homeowners. One of the most startling pieces of information for me was that we found that immigrant women are at the highest risk of housing insecurity. 50% of recent immigrant women lone parents are in need of core housing, half, which I think is just a shameful number for Canada. We looked at refugees and housing and homelessness as well. And over half of the refugees and asylum seekers who have come to Canada have relied on shelter services at some point and are in risk, in fact, of higher rates of homelessness. The other thing that I think I want to raise here, though, is the troubling pushback and dialogue we heard in a sort of different spaces in the Canadian diaspora around immigrants, refugees, and newcomers being part of the problem why there aren't shelter beds for other people. And so there was a really sort of a racist kind of dialogue going on around blaming immigrants, newcomers, refugees, and racialized communities for taking up much needed shelter space, which I think is really, really problematic. I want to also talk to you about something that is dubbed in Canada as redlining, not my term, but one that's used sort of in the larger strain. Racialized groups, redlining essentially what it means is that racialized groups are often forced to accept housing that is unsafe, unhealthy, substandard, and in neighborhoods that tend to have higher crime rates and lower average incomes. So
what we're 2 minutes, Shalini.
What we're finding is that racialized groups are tending to be pushed into very poor housing options. And I worked with a group of tenants last week in a home that it was a 3-bedroom apartment with 16 international students living in it. And that is not an uncommon picture. And why I raise it is because one of the biggest issues with homelessness and housing in racialized communities is hidden homelessness. Most of the clients that I work with are not often accessing traditional shelter services, but are in fact the hidden homeless. And we have repeatedly called on Canada to start looking at that hidden homeless piece. These are people who are living in their cars, couch surfing daily, weekly, from time to time. And to be frank, in the past several months, I've spoken to many clients who are now facing the reality of this situation. And like Kathy said, with other spaces closing down, other access to libraries, all those things, I have more clients who tell me now that they're living in their cars than I've ever had in the past 20 years. We have no real data or understanding on the extent of hidden homelessness for racialized communities at all. Finally, a lot of my work is on gender-based violence. And I have to say that housing and homelessness is directly putting people in situations that are unsafe. Many of my clients over the past 6 months who should be leaving are scared to leave because of unsafe shelter conditions, are scared to leave because we have very little in the way of transitional housing, and are scared to leave because they don't actually know where they'd be permanently housed. And so we are now at a situation with people facing gender-based violence where they are choosing to stay in homes that are unsafe because of the homelessness and housing issue. You know, ultimately, I'll end by saying that racialized people experience disproportionately higher levels of homelessness and poor housing. Immigrants, refugees, racialized communities are at real risk of homelessness and are in homelessness due to poverty, discrimination, cuts to social programs, lack of access to income security, and lack of access to housing. We need to do a number of things, which I'm sure we'll talk about in the group discussion, but where we are truly failing is to really target some of those vulnerable communities, understand what's happening, collect the data on those communities, and create some targeted supports that address homelessness and housing for racialized communities. Thank you.
Thanks so much, Shalini, for building on the problems explaining the problems that Steve and Kathy both flagged around sort of the homelessness strategies. but then also explaining the particular problems experienced by racialized communities, not just around homelessness, but also around precarious housing, discrimination, and that hidden homelessness.
Emily, I will keep the time for you.
Oh, thank you. So I want to speak a little bit today, really building on what Kathy spoke about the court case that we were involved in. And I think the reasons why Aboriginal Legal Services chose to get involved have been very well explained by Steve in terms of the overrepresentation of Indigenous people who experience homelessness across the country, on reserve and off reserve, and particularly in Toronto. And so I think Kathy helped remind us all what it was like at the very beginning of the pandemic. It was that time of, what Steve talked about, calling people and getting everyone's voicemails. Kathy reminding us that all the libraries and everything's shutting down. In that world-changing time when all of a sudden I stopped taking the streetcar to work every day and meeting in little rooms with all kinds of people and instead was working from my own home, very quickly, those of us at Aboriginal Legal Services and at other frontline agencies began to think about the folks we served. And there was a lot of talk at the beginning of the pandemic about congregate living settings, a term I'd never heard before. But all of a sudden, people were thinking about particularly long-term care homes and other kinds of congregate living settings. But I didn't hear people talking about what was happening in homeless shelters and what was happening in prisons, which is another area that we got involved in. And so we connected with other legal clinics and other folks that we had good working relationship with to think about what could we do to try to help change the conversation and help protect people who were the most vulnerable. The public health data shows that folks who use homeless shelters are more likely to have underlying health conditions. So they are more at risk for this particular disease, and they're in congregate living, which we know makes them more at risk for COVID transmission. So eventually a coalition came together. The coalition was made up of Sanctuary, which is a housing provider, a homeless shelter, the Advocacy Centre for Tenants Ontario, ATCO, HALCO, the HIV/AIDS Legal Clinic, the Black Legal Action Centre, and Aboriginal Legal Services. And we started working with some lawyers, Jessica Orkin, and some other lawyers who were trying to think through a strategy. How could we push this agenda and try to address the concerns we were seeing? And I think it's, what you want to do, and what I think all of us who've spoken so far want to do, is to say this can't be right. We can't live in this city and in this country where there is so much wealth and yet people are sleeping on the streets and people are sleeping in bunk beds, cheek by jowl in the middle of a pandemic. That just can't be right. That can't be legal. But we've seen before that efforts to go to court to assert a positive right to housing have been largely unsuccessful in Canada. The law and courts and judges have usually said that is not a problem for courts to solve. That is a social problem, that is a political problem, that is an economic problem. So I think we were trying to think of what we could do, what legal tool we could use to try to do this in a way that would win. And I have to give credit to the many other people who were working on this case who really used civil litigation, which is not a area that I practice in, to really think about what positive right we could push. And so there are already shelter standards in place that require that beds be a certain distance apart for public health reasons. And so if that already exists, and as Kathy pointed out, doctors, researchers, the WHO, were all saying that we needed to create physical distancing. Maybe we could argue that the failure of the city, the failure of the health officials to mandate shelters, to move and create that space to protect public health, that failure to do so violated the charter. So we made an argument that the charter rights, section 7, life, liberty, and the protection and security of the person, and section 15, equality rights, because as we've heard from everybody so far, different people are disproportionately affected by homelessness. We could try to argue that those rights were engaged. And so that argument was further developed. And I think this is where it's really a privilege to be a lawyer working with people on the front lines. Because as I said, I wasn't aware that there were shelter standards. I didn't know how this worked. This isn't something that I had engaged with, but people like Steve, who runs NAMI Res, people like Kathy, who've been working on this for years, people like Shalini, who have looked at the housing strategies more carefully, are aware of these things. And so getting to tap into that wisdom of people who've been doing this work for a long time means that we as lawyers can think about, okay, how can we use that to push for protections? So we developed this argument. We filed a court action. We also used a media strategy and also used political action. And I think that's also really important to remember, that the success of this campaign was really partly about the law, but it was also partly about other tools in people's tool belts. And there were times when, as we were lawyers meeting on the calls, having strategy calls or meeting with our clients, trying to figure out how we should draft a legal argument, we would get a report from someone at Sanctuary or someone who was working on the front lines about a direct action that was being taken because the city was taking steps to clear an encampment. And people were going and putting their bodies in front of the officials who were trying to clear them, and that was being effective. So I think it's important to remember that the law and using the law as a tool was not operating in a vacuum. We were also working on a communication strategy, trying to use the media to keep the pressure up so that questions were being asked, and when the city was having a press conference or the city was rolling out an announcement, that the pressure that we were trying to put on to keep the experiences of people who were experiencing homelessness, who were leaving shelters because they felt unsafe, but who were also unsafe in encampments, to keep that pressure on politicians as well, and to keep the media engaged so that people who were at home, who themselves were experiencing the pandemic, could also remember to think not just of themselves in their four walls of their homes, but to think of the people who didn't have that. And so, as Kathy said, it's a bit of a long story and it's still ongoing, but the upshot was that eventually the city agreed. On the eve of the court date, the city agreed that they would enter into a binding agreement with us as the applicants, and they would agree that they would ensure physical distancing. They would keep every bed in the shelter system, including respite centers, 2 meters apart. They wouldn't use bunk beds. And they would report to us weekly on their progress. That was a success, and we would rather have come to an agreement. We didn't want to be using our resources or their resources to be fighting in court. Their main argument through all of this was that they had a hard job, that dealing with this as the city, trying to meet all the needs as shelter providers, it was a really hard job, and we didn't disagree with them. It is a hard job. And so we would be happy to enter into this agreement and just see really that the bare minimum that needs to be done, which is, let's just give people 2 meters distance in the places where they're sleeping every night. The same protections that we want for ourselves and our families, for what we want for people in long-term care homes, what we expect at the grocery store. Let's just bring that bare minimum in. It's the least we can do. That the city was prepared to agree to that. The next chapter occurred on June 15th, when the city said that they had reached compliance, that under the agreement that every bed in the shelter was in fact 2 meters apart.
We've got 2 minutes, Emily.
Thanks, Kike. That didn't match up with what people were telling us. Those folks who work on the front line, people who use shelters, clients of ours were telling us that that was not the case. And so we then had an argument in court about what information had to be shared for us to be able to properly answer these questions. Ultimately, the question of whether or not the city reached compliance went to court on October 1st. And again, I have to give credit to the other lawyers, because this then became a breach of contract case, because really we had a contract with the city and we said they breached it. That's also not an area I practice in, so I can take no credit for the great oral and written advocacy that was done by the lawyers that we were working with. And they were able to convince the judge that this was not the case, that the city had not reached compliance. And the result of that is we have more questions to ask public health about what 2 meters means and how to keep people safe, but that we have to continue to receive reports from the city. And so that will allow us to continue to put pressure on the city and to be vigilant about the services that the city is providing. So for me, it was a really eye-opening experience about how the nuts and bolts of our shelter system works, or frankly doesn't work in a lot of ways in the largest part of the system, and also on the need to really work together as lawyers and as activists and as service providers and as specialists in the communities that we serve, that, you know, the special knowledge that Steve has about the community that he works with every day, the knowledge that Shalani has with the community that she works with every day, that we need to draw all of that information together as we work to really achieve what we all want to achieve, which is not better shelters and beds 2 meters apart, but safe, stable, affordable housing for everybody in Toronto and everybody in Canada. So that concludes my comments, and I think we were then going to move into a general conversation about some of the issues that we have talked about so far today. And there were some questions that we had sent out earlier, and I'm happy to pose them, but I wondered if any of our panelists had something they wanted to just say based on having heard all of the other panelists speak. Such a quiet bunch. Or perhaps they just can't find their mutes. Oh, go ahead, Steve.
Oh, me? Oh, I just turned myself off mute in case there's a question. Well, more or less, you know, through this pandemic, it really shone the light on you know, some of the shortcomings within the city. I know with NamiRes, you know, we've been invited to participate and contribute to the shelter recovery strategy. You know, I didn't feel that the strategy went far enough. And then with some of the winter preparedness, I was talking back in August about how we need to come up with a winter plan. And again, I don't believe the winter plan goes far enough. There's not an Indigenous component to it, which I'm very displeased about. And you know, I know that we can do better. So can't do it alone either.
Emily, I wanted to also raise just one point around impending homelessness. And so, especially in Ontario, and I think this is happening across the country, all of those moratoriums on evictions are now lifted. Suddenly, apparently, it's safe to evict again. And I think a lot of the people that we work with are renters, and we are starting to see the flood of calls from all of those communities around what happens now if they can't catch up on their rent. And I think when you sort of intersect that with that hidden homelessness piece around all of those people who are not accessing shelters but are trying to figure out alternative ways to deal with homelessness, that I have just a pit in my stomach thinking about what's going to happen in the months coming, in particular as it gets colder. And, you know, really and truly, this is the most number of clients I've ever seen in my work at clinics living in cars and moving like every 1 to 2 days because people are kind enough to stay. You could stay here for a little while, you could stay here. But as the numbers with COVID continue to rise, even those people who are offering up those spaces also feel uncomfortable now. And we haven't had any real discussion at all in Canada about tackling what is going to come, what is going to happen with this impending homeless population.
Yeah, I agree with that. Frontline workers are just trying to keep their head above water, and advocacy movements, you know, have been impacted by, you know, it's hard to do advocacy on Zoom, right? And gradually organizations and groups have done physically distancing press conferences and rallies, but it's very challenging. We are going to have a flood of people into homelessness once the evictions court gets moving. It's undeniable. And the city is very good with its language, right? In terms of talking about rapid housing and winter plan. And I agree with Steve, the winter plan is actually scary. It's shocking. One of the components is to open a 100-bed congregate, that word again, congregate shelter at the Better Living Center on the exhibition grounds. So why in a pandemic would you open another congregate setting, even if you separate beds? And you know, Emily knows how the city is arguing. Is it 2 meters just on the sides of bed, or is it around the whole bed? And the city is looking at working with shelter providers to use plexiglass between beds. And these are all like Band-Aids. These are all Band-Aids. And I want to point out that, you know, as I say, the only clear protection in a pandemic is one room per person or one household per unit. And the city is receiving federal money that's called acquisition money so that they can purchase buildings. They can purchase empty hotels or empty office buildings and convert them into social housing. Kingston did that last week. They bought an empty retirement home. Toronto has not bought one property yet. So we are drowning in the bureaucracy and the lack of urgency by Mayor Tory and city officials. So as people hear about these wonderful things the city is doing, yes, they've moved thousands of people into hotels, but people in those hotels are stuck there. They are stuck there waiting to see what meal they'll get at noon or at supper time with inadequate supports. And somebody in the Q&A asked about the fast track housing initiative. There's nowhere to fast track people to except the private market that could include, you know, apartments in Scarborough or out near the airport away from people's supports, you know. So it's very, very challenging. And I agree, the sense of urgency is just not there.
And just to add to that, trying to get an understanding of the picture outside of Toronto, because we work province-wide, is even more difficult. Trying to understand what supports are available in places like Peel, York, Durham, and we know that low-income communities, we know that racialized communities are rapidly moving outside of the city because of the cost of living, right? But we don't have a sense from other parts of what we call sort of the GTA around, you know, what is actually happening in terms of the critical need for temporary transitional housing and affordable housing in those places.
And just to pick up on that point around sort of really not knowing what's going on, and then also Kathy's point around the challenge of trying to do this work while we are also all affected by the pandemic. I think that's been our experience trying to find out what's happening in provincial correctional facilities. The federal government came out fairly early on and started releasing numbers about whether there was testing, whether there were outbreaks in federal facilities, and there were some pretty serious outbreaks in BC. But we began asking those questions of the province and had a really hard time getting the answers. And so again, even perhaps as part of the pressure of those who do advocacy on behalf of homeless people, the city began releasing numbers around testing and outbreaks in the shelter system. We were getting long-term care numbers, but there was a black hole with regard to what was happening in provincial correctional facilities. And so again, another coalition of people began to try to push on that. And so there has been some information being provided. Our Freedom of Information request about the big announcements at the beginning of the pandemic about depopulating the jails, who that was and who got depopulated, because we don't think it probably, we suspect that it may have worsened overrepresentation of Indigenous and racialized people. We still don't have answers to that. So I think the lack of transparency for government agencies and government providers at every level is really troubling when we're trying to all make decisions based on evidence and on science, when we don't even know what's happening. It's very challenging. We have about 15 minutes left. I don't know if I want to make sure that anyone who is a panelist had a chance to wrap up or reflect on any points that anyone else made. Some of the questions that were in the discussion panel that had sort of invited people to this panel were about actions that homeless people themselves have taken or tried to take to protect themselves during the pandemic, and steps that activists and frontline workers and lawyers have taken to demand a public health plan, changes that folks have seen, and about what we would recommend to people who care about this issue and want to do something about this. So if any of those questions spark an answer, I want to invite people to share them.
So a group of homeless people from one of the encampments, along with Ontario Coalition Against Poverty and the Overdose Prevention Society, also took the city to court seeking an injunction to prevent evictions from encampments. And unfortunately, the judge did not rule in their favor, and they're still within the appeal period, so they may appeal, I don't know. There's a few fronts where people can advocate. Today at noon, the Encampment Support Network is leading a huge city councillor lobby by phone and email. And you don't have to do it at noon. You can contact your city councillor. They have been 100% silent on these issues. That's my opinion. And in the meantime, we are campaigning for more hotel acquisitions to move people safely into hotel shelters, but we're also campaigning to support people in encampments. And that means that donations are needed and calls to counselors to stop evictions there. And again, the Encampment Support Network is the primary volunteer organizing group on that issue.
I would also say that if people get a chance to take a look at the Advocacy Centre for Tenants of Ontario, ACTO's website, very quietly, the province passed a bill to lift the moratorium on evictions, has not addressed any kind of rent control. And we're actually seeing applications from landlords to increase their rent above the guideline as we speak, during a time where most of the people impacted have lost their employment or have had significantly reduced employment. So we've lost a significant amount of protections for tenants. And if you go to the ACTO website, I would definitely suggest taking a look at their campaign on what was called Bill 184, which is now passed, and trying to push back against the province, because we hear a lot of this, you know, very lovely language from the province around doing what's right, not letting people down, supporting people. But the reality is that they have let renters, tenants down wholeheartedly in this province. And the reality of what's going to happen to those people in terms of their housing precarity is really significant. So I think we need to push back on the level of the province, who really has the jurisdiction to make sure that those people also now do not fall into the growing population of homeless or unhoused people in the province.
I'm seeing some questions in the chat. One question is, I guess if we email our city councillors, what specifically should we be demanding? So I don't know if anyone has an answer for that in terms of a specific ask.
I was typing the answer to that right now.
Oh, there you go.
So it would be to stop the evictions of encampments and to provide the supports there that people need, including toilets, water, garbage and recycling pickup. That's one. Two, to acquire more hotels for shelter hotels. Three, to acquire more housing rent supplements so that people can be fast-tracked from shelter into hotel. Those are a few of them, but I urge you to go to the Encampment Support Network site to get like a full list. There's some things the city will say are out of their control, and it's not totally true. So we need more testing. Everyone, I think, now understands the importance of more accessible testing. It's impressive that Steve mentioned his organization started specific testing. And right now, testing is appointment-based only, with the exception of a place like Steve that has created testing for his clients, his population. So there's like a whole range of issues, but mostly that we want them to stand up and speak out and advocate and purchase some buildings to convert them into housing in the next 6 months.
There's another question about the cost of sheltering the unsheltered. And the person who writes, my reason for asking this is I believe it's possible to create a solution with a different model. And I guess, I don't know, I would imagine that all of us as panelists would know that I'm sure that the cost of providing stable housing is much less than the cost of providing certainly a jail cell, certainly emergency medical services, certainly shelter beds. I don't know whether Steve or Kathy, those of you who you work really on the front lines of this, have any comment about sort of the way we're doing business here.
Well, I know when we started our mental health program, Minnow Conagowan, we did it because we were seeing gaps in services for Indigenous people who had severe mental health issues and addictions. We noticed that within our shelter that if we had a person come to us who had, mental health issues that were undiagnosed and really off the charts, they would stay with us for a short time and then go somewhere else to another shelter. Then they would come back to us and either be in the same condition or worse off. And that's when we recognized these guys are falling through the cracks. We need to do something to help them. So, I started writing some grants, trying to get some funding, and was able to secure funds to hire a nurse as well as a case manager to do an intensive case management, but also to accompany people that were seeking medical help for their mental health issues and accompany them to appointments. It's well documented within Canada that racism exists within the healthcare system. We know it. People are still, questioning whether it's systemic racism. In my mind, no question. But what I do know, the equalizer is if you bring a nurse with you who will advocate for you in a medical setting, if you're not getting proper treatment, you're going to get good treatment. If you go by yourself when you're presenting yourself as homeless and you look disheveled or whatever, you're not likely going to get good treatment. So this program started and it really helped to get some of these guys settled. Once they get housed, we'll still work with them and follow up in their housing and make sure they're, integrating into their communities and be able to access services and programs. So, that program has been a real equalizer for people. The real kicker is, that program is not funded by Ministry of Health. Namirez has a variety of health services, but we don't have a direct funding relationship with Ministry of Health or Toronto Central LHINs or Ontario Health Teams. Real inequity, and it really sucks when non-Native organizations apply for Indigenous services and get it no problem. We know we can do these services better than anyone else when it comes to delivering Indigenous services. I really wish that there was some sort of policy or something that required funding bodies to do an environmental scan of Indigenous organizations who are already doing the services rather than just funding non-Natives. It's colonialism revisited all over again.
I don't know whether either of you had other comments about sort of the costs that are related to, sort of providing emergency services and always sort of just doing Band-Aids. I also see some of the themes in the chat being about private sort of inequity generally, about banks and about landowners and about sort of where, sort of capital is held, and about really that the bigger issue of needing to address some of those larger inequities. So I don't know whether either of you have a comment about those kinds of themes.
Well, the average shelter cost, and these are I'm really bad with numbers, so these are very rough, but the average monthly cost to run a shelter is around $3,000, and it skyrocketed to close to $9,000 per month with the use of shelter hotels, because everything had to be like, not exactly privatized, but everything had to be farmed out in terms of security, food delivery, and it's just a nightmare. But the federal government is really kind of just allowing that to happen, right? They are not investing in a fully funded national housing program that would include, an Indigenous national housing program. And so the movie Push, P-U-S-H, Push, is an international documentary that can be accessed now, I believe, online through streaming. It's a documentary that really shows the behind the scenes financialization of housing, including in Canada. And it features Lalani Farha, who was the UN rapporteur, and she's Canadian. So I think a really good example of where the government is at right now is the creation of modular housing in Toronto. So while I have in the past advocated for that, we're going to see a couple of hundred units of modular housing developed, but that's in the absence of a national program. So you could really look at that. It's going to be modular housing, around 50 units in Scarborough and 50 in downtown Toronto, that is going to be very specifically purposed to house homeless people. And we're all excited about that. I mean, of course we want housing for people, but what we are creating in the absence of a national program of housing for all is housing for poor people. You could almost call it apartheid housing. And that is the kind of almost the only initiative happening in Toronto right now. If you look at the cranes in the sky, those cranes are not building Indigenous housing or housing for families with children, or housing for students, for Ryerson students that are listening. So we really have to come back to the full circle of realizing we have to have housing for all that is like Medicare for all. Although I know that's not perfect, but we have to have a national program that puts new stock into our communities.
Can I just pick up on the piece around banks and how sort of money has how profit has developed during COVID-19, because we know large corporations have profited tremendously, but that piece around small landlords and their struggle to pay their own mortgages and then having to go after tenants is a live issue. But what we do know now across Canada, and in particular in Ontario, is that the rental market is actually more largely owned by corporations as landlords than small landlords. We have had a sort of a corporatization of the rental market in Ontario. So the reality is there are some very large corporations who are the largest landlords across the country who are not struggling. They are not struggling with this issue. And for those who are struggling as landlords, certain banks do have mortgage deferral programs, but the province and the federal government haven't provided a definitive requirement, right, that they do that. And so it's a mistake at all levels, right? No eviction moratorium, no consideration of what happens to small landlords. There's a whole chain of mistakes being made that are going to lead to that issue. And if you think about it, it's always the low income, Indigenous, racialized, gendered, disability populations who are getting hit. If you look at employment, it's always the worker getting hit. Employers are not subject to the same liability. Landlords are not going to be subject to the same liability that tenants are, right? And so we have to really have consideration in the short term of figuring out, unfortunately, a Band-Aid solution, but we have to have longer term consideration around the complete failure in housing and in rental housing. We don't have a way to not increase rent, right? We don't have rent abatements. We don't have any of those programs in place from a legislative perspective that will support tenants long-term either. So I think the mistake is all the way up and down the ladder. And the only place that it hits the hardest is at the bottom, where we see the people who are unhoused or precariously housed or renting and in danger. And so we really need to talk about that piece and flipping that, right? Flipping the responsibility. And I think really quickly, we really need to talk about at the federal level. I'm really tired of talking about this, but their decision not to collect proper data on the picture around homelessness and hidden homelessness in Canada. That's not something that they couldn't get to. That's a choice. They've made a choice that they're not collecting that information so that we don't know the real picture, except that we're on the ground and anecdotally we know what's happening to people, right? And they've been dinged internationally by the UN over and over by every probably panelist on this call. And that piece is just incredibly frustrating.
I don't think I can say it better than that you just wrapped it up. And I think that picks up on a theme that we've heard throughout this presentation and also a question in the group, which is really the responsibility lies with all levels of government, and that we need to have a broader, this conversation with about the inequities in many different aspects. So I will end my comments here. I'm not sure whether Kike, if you're going to end the session for us, but I really appreciate the comments of all of the contributors and the very thoughtful questions. And I imagine we could spend all day continuing these conversations, and I'm imagining that they will probably be themes that will be picked up later on through Social Justice Week.
Yes, thank you so much. You've all brought us such a wealth of information. It's been really valuable for us to hear from the different perspectives, that of a street nurse, somebody who is running an agency, lawyers who are on the ground, telling us how this is impacting all of us ultimately. So thank you so much, Kathy, Shalini, Steve, Emily, for all your contributions. If you're looking to find out more information, how can you get involved? How can you follow up on all of these issues? I would recommend that you go to ryerson.ca/social justice, which is our website. There under resources, you can find a whole wealth of organizations that are working on these issues. You can also follow Kathy on social media, where she regularly tweets about these issues. On Twitter, she's at Kathy A. Crow, and constantly telling people about actions that are happening. You can look at our website and the Social Justice Week information, our program information that has the full bios from all of our presenters here today. So you can find out more about what is Shalini and the South Asian Legal Clinic of Ontario up to. You can find out more about Steve Teakins and what is Name Res doing. Look there, and you can also find out more information about Emily's organization, the Aboriginal Legal Services Clinic. So once again, thank you very much for joining us. And that concludes our opening session, Housing in Crisis.
Thank you all.
Bye, everyone.
Miigwech, everyone.
Miigwech.